Hey everyone, welcome to this edition of the CHP Spotlight Interview Series. Today, I am joined by Dr. Pandarinath. Did I get that right?
That's great.
Perfect. All right. Before this, everybody, I had to practice a couple times to make sure I got it right. But Dr. Pandarinath is he's an orthopedic surgeon with Washington Sports Medicine Institute and Ortho Bethesda. So if you're in Bethesda area, Northern Virginia area, you'll be able to find him. Dr. Pendernath, he's board certified orthopedic surgeon specializing in treatment of complex shoulder, hip, knee injuries, really doing some cutting edge stuff. So I'm really excited for him to join us today. So first off, thank you for joining us.
Oh, thanks for having me. It's really great to be on with you today.
Absolutely. So first off, I'd love to hear just in your own words, a little bit about what you do, like the conditions that you treat, types of patients you typically help. Love to hear a little more about that.
Sure. I mean, I think sports medicine is actually a confusing name for a lot of people because we take care of athletes also, but we don't only take care of athletes. What I like to think of it as is more of like joint preservation. So when people are born with their joints, we try to preserve them or extend the life of their joints as long as possible, and we do that usually with various techniques. And sometimes it can be like a physical therapy approach or a injection approach or a combination. And sometimes we'll do surgeries, which can include um, most commonly arthroscopic surgeries to do things such as restore cartilage in a joint or repair ligaments that are torn, um, or to repair torn tendons. But really, it's just about trying to do things to help prolong the life of a joint and avoid joint replacement.
Yeah, I appreciate you sharing that. Now, speaking of that, um, I've heard and read a lot about the importance of delaying and if possible avoiding altogether joint replacements. What in I guess the most simplest terms possible. What is the it might seem obvious, but what is the benefit of delaying that? Delaying those types of surgeries with maybe a different type of surgery as an example, because to a lot of patients, a question I've gotten before is like, well, I'm going to have surgery either way.
Right.
So yeah, I'd love to hear a little bit about that.
Sure, that's a good point. So I think with joint replacement, what you're doing is you're removing what's left of your joint. So you're taking out the cartilage that's left, for example, in a knee or a hip or a shoulder, and you're replacing it with metal and plastic um, that the idea is that that serves to replace your joint. But unfortunately, the metal and plastic doesn't quite last as long as your joint did usually. So for a lot of people, if they have a joint replacement at a really young age, um, they may need further surgeries down the line. So it's not just one joint replacement, it could be multiple. And the other thing is, although we try to make things better with surgery, we're still far from perfect. So a lot of people feel that when they have a joint replacement, that the knee or hip doesn't totally feel natural. It feels like a mechanical joint. So while it's better in that they're having a lot less pain and able to do more activities, they don't feel like they did when they were 20 years old. So there's certain things we can't turn back the clock on for surgery. So I think especially for our younger patients that might need to have multiple joint replacements, it's best to try to prolong the life of the joint as long as possible.
Got it. Yes, I got to imagine, right? I know. I've talked to our patients about who maybe are looking at it where they're like, yeah, I'm probably going to need a joint replacement at some point. A lot of times, what I'll describe it as like you want to push it back as much as possible because ideally, if you push it late enough in life, then maybe you only have to have it done once, and
Right.
the surgery done once is probably better than the surgery done twice. So,
Yeah.
I think it's a great way to think about it as well. And for like the you mentioned obviously you mentioned a bunch of really cool things you do and you see a very
hmm
active audience. What are there any like injuries that you see or conditions that you see that are maybe more common than others?
Yeah. I think, for example, with the knee, I think one of the most common injuries I see are ACL tears.
Mhm.
That's a really common injury that we see. COVID actually gave us a break from that for a little while without organized sports as much, but now that we're kind of back into the swing of things, we see people injuring their ACLs all the time. And what that is usually like a rotational injury to the knee. Very commonly, not even from being tackled or being hit by someone else, but just a non-contact injury where you're trying to use your knee to stabilize you or to pivot or cut, and then with that rotational movement on the knee, the ligament can just tear. And unfortunately, in most cases, it doesn't heal very well. So for people wanting to get back to the sport of their choice, we often do an ACL reconstruction or repair to kind of restore the stability back to the knee.
Gotcha. I appreciate sharing that. And then I know a lot of people watching this, or people maybe themselves have themselves, family members, friends that have torn their ACL. Maybe it could have been a while ago.
Hmm.
But I know a lot of people continue to still have like some residual issues with it, and some of it can be because of maybe how they approach it from a rehab standpoint. After the fact, do you have any recommendations you typically give to, let's say, a youth athlete, high school athlete, and versus like a weekend warrior type adult that may have this kind of surgery? Like, how do these types of people know like when they're safe to be able to return to the activity that maybe caused or where they had the issue in the first place?
Right. And I think touch on a lot of good points there. So first of all, I consider their goals number one. So I think the high school athlete, they're looking at how quickly can I get back to a sport, and maybe that's a more similar situation to even like a competitive or professional athlete where time out of the sport is kind of a big deal. So I think in that case, we're really looking at how can we maximize their rehab after surgery and get them going quicker. Whereas with the weekend warrior, their biggest question might be like, how long do I have to take time off of work, or how long do I have to be on crutches, and when can I drive to work? And so it's a lot more like activities of daily living type of things that they want to get back to. Um, and so perhaps for them, they might not be as focused on when can I get back to my tennis match on the weekends, or when can I play flag football again, or something like that. But um, I think that the best thing that I found is that what we can track in the office is we can take a look at people's stability of their knee. So I can test their stability. That's something I can do just with a clinical examination. I can test their swelling. I can look at their legs and kind of get a general judge of their muscle recovery. But what I like to do for people who are actually going back to a sport is to have them see their physical therapist and do some focused muscle testing to make sure that their legs are fairly symmetric and that they can do all the activities that they might need to do in their sport before they're actually like playing a game or even doing a lot of drills where they may injure themselves.
Gotcha. That's super helpful. And for further clarification on that, you mentioned um, just go back to the weekend warrior one. Like a lot of them
Mhm.
might want to know, like, hey, when can I start driving, going to work again? Do you have
Right.
some parameters around how you answer that question?
Yeah, definitely a big difference if it's your right or left knee for most people that aren't driving a stick shift. So left knee, it's a lot quicker, but generally the most important thing when you're driving is to be able to get from the accelerator to the brake. So if you don't have the quadriceps muscle control to where you can lift your foot off the accelerator and hit the brake rapidly, then it's really not safe to drive. So I make sure that they can do things like a straight leg raise. Um, and that they have good range of motion of their knee enough to get in and out of the car easily, but also to like flex their knee to switch pedals. And then of course they have to be off of any kind of narcotic medication.
Gotcha. That's super helpful to get some clarity on. Then, of course, you touched on the athletes and the things they need to be able to almost tests they need to be able to pass before
Right.
returning to play. Do you you mentioned the strength stuff and
Hmm.
things like that? Are there any tests in particular that you like to see for any athlete out there who's like, hey, can I return to soccer? Can I return to basketball? Whatever it might be.
Right. So early on, so there's different milestones that people usually hit after the surgery. So initially, in the first month, they're just working on range of motion. They're trying to get their knee bending well, and even maybe more importantly, getting their knee to straighten out well.
Mm.
But after that, It's kind of getting the muscles to recover better and getting the swelling down. And around 6 to 9 months after surgery, depending on what kind of graft they have, I'll usually have them see their physical therapist, and they can do some different tests that involve different kinds of hopping and muscle testing to kind of see one, how strong they are, but two, that their injured leg is, within 10% or so of their uninjured leg. Because what we see is that people who go back too soon, where they haven't recovered to the muscle strength of their uninjured leg, they tend to overcompensate, and they'll plant harder when they're changing directions on their good leg, and they'll tear their other ACL.
That was a really good insight, and I think that isn't something a lot of people often think about, is that the other side could be at risk for some of the factors you mentioned.
Hmm.
And so, is there anything, you obviously see what's out a lot of, there's always a lot of ACLs tend to be, speaking of that, tend to be like a big topic. It can
Right.
be in reference to ACLs, it can be in reference to just other things that you see, because I know you see,
Sure.
issues with the shoulder, with the
Right.
hip as well. But is there anything that you wished that like the public knew, whether it's if it's kids, the patients and the parents, or adults if they're the patients themselves, knew that might maybe reduce the incidence of some of these injuries that you're seeing?
Well, I think especially in the kids population, what we find is that a lot of kids, younger and younger, are starting to find a sport they're good at, and then really like specialize or focus in on that sport. And I think that's good in some ways. It helps them get really good as they get older, and they can kind of fine tune things as they get to like the high school level. But as we're growing, I think it's good to be able to use the entire body. So sometimes we'll see, like, for example, like baseball pitchers in little league throwing way too much. They're throwing way too hard, and they can even get like stress fractures in their shoulder or injuries that really take them out for a while because they're working so hard at one thing. And I think getting some variety in the tasks you're doing, whether it's, for example, in baseball, playing different positions, or just playing multiple sports, so that you're not just using one arm all the time. All those things can be really helpful in avoiding injury.
Yeah, it's interesting you mentioned that, like especially the baseball example. I know I was speaking with a person the other day, and he runs like a big baseball academy, and he was
Yeah.
saying that a lot of coaches that he works with, they still like the pitch count thing. It's still not being implemented or to the way they would like. Or what happens is they stay within the pitch count, and then when the pitcher's done, when they go back in and play in the field, it ends up they put him at third base, and
Right.
as opposed to playing first. And so it's things like that where we only have so many bullets in the chamber, so to speak, when it comes to such an unnatural motion such as throwing. And so
Right.
it's oftentimes important to keep that in mind. And it seems simple, but I think being reminded of that is always a powerful thing. So, and and I'm curious, if I'm a patient out there, let's say I'm somebody
Mhm.
with a shoulder, elbow, hip, knee injury. Um, how do I know when it's time for me to maybe see somebody like you? Like, when do I know if it's just like, okay, my arm might be a little sore, my hip might be a little funky, versus like, oh, I
Right.
probably need to give doc a call and get this looked at.
Yeah, I mean, I think you know there's there's a few like different warning signs I think you can look at as to when you might need to see a doctor. For example, for shoulders, I think a lot of times we see people with rotator cuff tears, for example. But when you have like a traumatic injury to your shoulder, and then you can't lift your arm up for a couple of days, sometimes it actually can be nothing, but a lot of times it's good to get that checked out pretty early on. You don't want to miss having a tear of your rotator cuff for months and months, where you're trying to just recover from an injury and it's just not happening. For lower extremity, I think one big thing is the ability to walk after the injury. So, like, there's a lot of sometimes people have like a knee strain, for example, or a hip strain, but then after 5 or 10 minutes, they may be able to go back in and play and finish the game. Usually that's a better prognosis than someone who has to be like helped off the field or felt a pop in the joint when the injury happened, or has trouble walking, or perhaps like a lot of swelling in the joint, that's been going on for a few days.
That's really helpful, and those are some really good specifics there. I'm going to jump on one thing you said because you mentioned um, the importance of not delaying like a potential shoulder rotator cuff injury where you just can't lift the arm a
Right.
significant amount. Why is that? Like, why is it dangerous to delay getting like a shoulder injury like that looked at?
Yeah, there's basically two main kinds of rotator cuff tears. So one is where as a person gets older, the rotator cuff kind of thins out over time, and then one day it just eventually tears completely. But that's something where generally with rehab and with the small tears, a lot of times people can get back to full activity without a whole lot of pain. Then there's this other type of rotator cuff tear where people have a fall, or they like land onto they land on their hand or their elbow or their shoulder, and then they immediately can't lift up their arm, or maybe they have a shoulder dislocation. And what you see there is usually people have like if they do tear their rotator cuff, they have a fairly big tear. And what happens is the tendon pulls pretty far away from the bone. Excuse me. And so what that does over time is it scars in to where the tendon can't be repaired back to the bone, or over time the muscle of the rotator cuff actually turns into fat. So then even if you are able to repair it, it doesn't quite get the strength that it had before. So for these traumatic rotator cuff tears, we like to really even get people into surgery within the first 2 to 3 months if possible. Um, but the good thing is that usually with those kinds of tears, people usually know that something's wrong. They kind of have an idea that this is like a really bad injury. This is not something that's gonna pass. I can't get my arm up in the air, and they usually do come in pretty quickly.
Mm, got it. Yeah, it's super helpful to know. And yeah, I know a lot of times it can be human nature to think like that you can put something off, but it's important to know which ones out there are the ones that like, hey, you got to sort of jump on it, and rotator cuff
Right.
tears and being a big one. So in all these different areas of expertise that you have
Mhm.
regarding, like we mentioned before, the shoulder, the hip, the knee, um, there's always new innovations, new exciting things happening in the field, in the surgical field, and the medical field in general.
Right.
What kinds of things what exciting things are out there that you're getting into this day that you're looking into that just I guess exciting you overall.
Yeah. Well, I mean, so I've been in practice for about 13 or 14 years, and mostly what we've seen in terms of innovations in sports medicine are like better implants. So like things are more absorbable in the body, or stronger, or maybe they are more minimally invasive. But I think the next wave of innovation is actually going to be more biologic. So now we're trying to figure out, like, okay, we repaired a tendon, but how do we tell your body it's time to repair this, or how do we signal to your own healing responses, like, okay, we've got some work to do. Let's go ahead and get this tendon to be repaired, or this ligament to be repaired. Or how can we repair things that we thought weren't repairable? So I think in the next 5 to 10 years, we're going to see a lot more biologic augmentation of different kinds of repairs that we're already doing, that increase our healing rates and improve our results.
That's really cool. That's really cool. Yeah, the biologics world is really interesting, and yeah, I'm excited to hear more about it as it comes out. And so, before we close out here today, I'm sure a lot of people here are watching, listening, and wondering, okay, well, Dr. Pandarinath, how do I find you? So
Yeah,
what is the best way to reach you?
yeah. So I've got a website that's just drpandernath.com. And you can also go to the Ortho Bethesda or the Washington Sports Medicine Institute website. But um, one of the advantages of our system is we actually have a really good online scheduling system. So when you go online, you can actually see the appointments that are available. So you can make your appointment time, and then you actually you know when your time is. You don't have to worry about someone calling you back or trying to like figure out a time in the future.
Yeah, always makes it easier. And for everybody watching too, as you can probably see, there's a link below the video, so you can find that site directly. But again, Dr. Pandarinath, I always want to make sure I get it right. Thank you again for joining us. It's super informative, and excited to see what more you have to share with us in the future.
Yeah, great. Thanks, and I'm happy to be here.